If we're able to get in that home within 7 days, make sure that their doctor's appointment, make sure that their medications, but most importantly, do they have enough food? Are their utilities paid for? Are they safe in their home? That reduces that readmission rate. It goes down to 7%. If we help them with their quality of life, then those costs that you're paying to hospitals and skilled nursing facilities, those costs go down because they're living better lives. Come on, let's stop treating the disease and start caring for the people.
Welcome to the Game-Changing Women of Healthcare, a podcast featuring exceptional women making an impact in healthcare today. We celebrate our guests' accomplishments, setbacks, and the lessons they've learned throughout their careers. We dig into the many healthcare issues we face today and how these innovative leaders are working to solve them. I'm Meg Escobosa. Join me in conversation with some of the many brilliant, courageous women on the front lines of the future of health. Hello, everyone. Today, I'm looking forward to talking with Jayme Ambrose, the CEO and founder of Adobe Care and Wellness in Phoenix, Arizona. Jayme, welcome.
Hi, Meg. Thanks for having me.
We are just thrilled. This is such a cool organization you've created. Would you mind sharing a little bit about yourself, your background, how you got into this field?
Absolutely. So I've been a nurse actually for 40 years. And prior to getting into Adobe, I had a very varied and interesting nursing background. So I'm not as you would call, a typical nurse. In fact, my grandfather would always say to me, when are you going to be a real nurse? Because I didn't work in a hospital. I started out actually as a psychiatric nurse. I did psych nursing for 15 years. And then I moved to workers' compensation case management because I had worked with a psychiatrist whose motto was, we are all crazy, just some of us have jobs. So when I got my first work comp job, it was for at that time, the world's largest distributor of fresh meat. So I worked with meat packers for another 7 years. And in that time, I was working with injured workers and identifying that one of the big barriers that they had in returning to work is they didn't have enough resources that were allowing them to recover. So what I did was I created, at that time, I called it a holistic case management program. And I would go into the home and I would make sure that they had food, that they had transportation to get to their doctor's appointments. And then we focused really on getting them back to work in light duty positions as quickly as possible. So really focusing on that mental health component too. And so as that happened, then we were able to reduce workers' compensation costs for the company. And then I moved to Arizona. So that was kind of the beginnings of where Adobe's concepts came into play, was looking at each individual from a holistic perspective. And then once I moved to Arizona, I went back to school. And in my doctoral program, my partner and I put together a program that was the basis of Adobe and sold it in our business course. And in doing that, that was the beginnings of what is now Adobe Care and Wellness.
Wow. Congratulations. I mean, to come up with something in school and then to be able to bring it to life in reality is amazing.
Absolutely. Yeah. It's awesome because so many people will say to you, well, what did your doctorate benefit you? And so I have the ability to say, this is what my doctorate benefited me. I was able to create a business from it. So.
And benefit the community, right?
Oh, I mean, absolutely. My God. Absolutely. Yeah. Yeah. Our mission at Adobe is to positively impact the lives we touch. And that's what we focus on every single day.
You know, it's so funny that you went right there. I appreciate you doing that because I was going to call that out specifically because it's a beautiful mission. You've also said that your company provides both technology and the human touch in order to proactively care for patients. There's a lot to unpack there, but maybe, it may seem obvious and unnecessary to mention the role of the human touch, the importance of the human touch in medicine or healthcare. But there's also concerns, as more and more technology kind of comes into healthcare, there's just the fact that you have to say, like, the human touch and technology, just that the human touch is still important and it's not only technology. So maybe can you explain what you mean by that and the importance of proactive care and how Adobe Care and Wellness operates? How do you strike a balance?
Yeah, absolutely. And it is a balance. So what we've been able to do from a technology standpoint is develop tools within our software development that allow us to do risk stratification. So when Adobe started, it was about how do we reduce hospitalizations? And at that time, the main idea was, we just make sure that they get to their doctor's appointment and they get their medications filled. And from our standpoint, looking at the social determinants, that they have food and that they, their utilities are on and all of those kinds of things. But it was all done on the back end, right? Once the hospitalization occurred. But as we've moved deeper and deeper into the coordination of care, what we've identified is that we have to be able to stop that hospitalization from ever occurring. So what we've identified is that 80% of the reasons that people are hospitalized or that their chronic condition becomes acute is related to a social determinant gap. Right? Mm-hmm. They can't afford their meds. They can't get to their doctor's appointments. They don't have money for food, all of those issues. So let's identify those at greatest risk, address those issues first, and that's where the technology comes in. We get the data from the insurance plans that we partner with. We run it through our risk stratification tool. We identify those top individuals and we start contacting them prior to anything happening. Mm-hmm. And in doing so, we're able to identify 9% of them don't have enough money for food. 9% of them have issues paying for their meds. 11% of them don't have transportation to get to their doctor's appointments. So we resolve those issues. And how we resolve those is we then use that human touch. We send someone into the home. We do a full assessment. We look at all of the barriers to them being healthy, and we reduce those risks. And in combining those two, we're able to absolutely prove that if we improve the quality of life, we decrease overall health costs. And that's the brilliance of it. And it's so simple, right? It's so simple. It's like, let's not keep throwing all these dollars into other issues other than making people's lives better. And that's really how those two, how that human touch and that technology piece combine.
Really, it is beautiful and sort of elegant, what you described. The issue of finding those people to provide that human touch, I'm sure there's some challenge there. I know that there is a great shortage in nurses. Who are the case managers? How do you find great people? Is that something you've got some good insight about and how to do that?
Well, this has been obviously the first year that we've been as challenged. So we have a team of nurses, we have social workers, we have what we call care navigators, they're medical assistants, we use registered dietitians, and then we have nurse practitioners. So all of those individuals are part of that integrated care team that surround the patients as their needs arise, and depending on what their needs are. And this year has been our greatest struggle with actually hiring, not the RNs. We're not having as much trouble with the RNs as we are with LPNs and medical assistants. That's really our greatest shortage right now.
Do you think technology can help in that area, either to complement or allow you to hire people with different skill sets that maybe aren't the traditional candidates?
Absolutely. So from a technology standpoint, that's really our human touch piece. There's really no way to tech that one out.
Yeah, right. To replace it with technology. Yeah.
We can't do that. But what we are doing is we're offering a program that if you're not a medical assistant, but you have good customer service, you come work for us and we'll pay for you to go to MA school. and we'll pay for you to get through MA school, and we'll put you in a different role until you're done with that. And that will allow us then to continue to feed ourselves moving forward. So we are doing that.
That's great.
We have obviously used a lot more telemedicine than we did prior to COVID, which has been a huge benefit, not just for us, but obviously for the patients as well. We've been super surprised because our population is generally the senior population with, they have smartphones and they are able to use them. And, that even though they're not technology natives, that it's clicking and it's working very well. So that's been a huge bonus as well, especially because our niche is the rural communities. So, and here in Arizona, it could be they live an hour away from anything. Yeah. So that's been a very positive as well. So we have used technology in that way to fill some of those gaps.
Yeah, for those of us that are living in a city, it's just we forget just how significant it is to be able to deliver care in the home like that through the computer, connect to professionals, help that person not feel isolated.
Absolutely.
So that's great. In terms of, psychiatric nurse background and this work that you're doing, how much does mental health care play a part in what you guys provide? Do you address mental health issues? And what's interesting is to think about you being a psychiatric nurse well before we probably had a broad appreciation for the mental health challenge that everyone addresses. So can you just describe a little bit about the mental health needs of your population and how you guys are tackling that?
Sure, absolutely. So we have always addressed the mental health issue. One of the assessments that we do on everyone is doing a measurement for their level of depression. And so we're always looking at that. Obviously, during COVID, those rates of depression went up significantly. And, one of the biggest issues that the rural senior population deals with is isolation, loneliness, which leads to depression. And then there's a direct correlation to depression and hospitalizations and non-adherence to, your care plan. All of those kinds of things play into that. So it's absolutely significant for what we do. And our social work team works diligently to get them into mental health services. And then we have what we call a telewell team that will call individuals on a daily basis or a weekly basis, however often, just to chat with them to help decrease that isolation. How's your puppy doing? Did your grandchildren come and see you? And then also, hey, did you take your blood pressure today? And did you remember to take your meds? And how much have you eaten today? And all of those things all play into that. So it's crucial to what we're doing. And we also then have events where we work with the senior centers and other community organizations in those counties where we're doing health fairs and sending out invitations to everyone to get everybody to come in. And it also then gets them to recognize, that senior center is really not that far from me. That barrier may not exist. So we're doing all of those things as well. But absolutely that connection is essential. And we want to make sure that those issues are addressed at all times.
Oh, that's great. You, I think, gave your IT team a challenge to develop a solution to help solve some of these issues. Can you describe how the new app Maslow was created and what it does?
Absolutely. It's an amazing thing. I work with a group of very talented millennials, and we always banter back and forth because I'm the boomer and they're the millennial, and we have that conversation, which is a lot of fun. But I asked them to create a resource tool in our EMR that would just basically, if the social worker was in the home and they said they needed resources, that they would find the closest ones. And what they absolutely did was they went far above that. They created our app called Maslow. And what Maslow does is it asks 13 questions related to social determinants and then geolocates the closest resource to that individual to help them resolve that issue. So here's the closest food bank, here's the closest opportunity to help get your utilities paid. And so what we have done now is taken Maslow, it's on a QR code. It now sits in a lot of the rural primary care doc's office so that they can take it from there. If we're unable to contact someone who's on, someone we need to get a hold of, we then text them that QR code, because at least let us help you. If you don't want to talk to us, at least use Maslow if you're at risk. And so we're gathering all that data to see what outcomes we can come up with. But we're very, very excited about it. To our knowledge, there's nothing else out there like it. So we're super pumped to get it into as many communities as possible.
Wow. I can appreciate that, having a tool like that for the user. Maybe there's some shame in some of this experience of realizing, like, I don't have enough food. This is just, I'm at this point in my life. How could this be? It's not a good experience, and it's something you don't really want to talk about. So I can imagine that being able to use a tool like that to help myself provide some level of dignity to the experience. So is that what you think is an element of why it's being successful or being used?
I think that, number one, you're doing it on your smartphone or you can do it on a tablet. When we are in dialysis centers, the social worker is right there with them and they'll help them fill it out. I think the biggest issue, too, especially with the senior population, to your point, is I'm ashamed I'm embarrassed that I'm at this place. But they also don't know that resources are available that could help them.
Right.
And so there's that lack of knowledge, that barrier that exists. And once we're able to help them identify those and it changes their lives, improves their quality of life, it's a huge, huge impact for them.
Can we back up just a bit to better understand your path into nursing? It sounds like you had a conversation with your dad. Can you tell us when and why you got inspired to pursue nursing? Was there something that sparked a passion or a personal experience?
Yeah, my aunt was a nurse. But she was a surgical nurse, so she was a real nurse compared to
thanks, Dad.
Compared to what I was. So, Interestingly, I really thought I was going to go to law school. And in my senior year, I was caring for one of my brothers. They had scraped their knee or something, and I was cleaning it off and putting a Band-Aid on it. And I thought, wow, this is really cool. I think I'll be a nurse instead. So that was the path that I took, and I have never, ever regretted it. I really am very passionate about being a nurse. It's a kind of a joke between my spouse and I that I think like a nurse. So, if there's something going on, and that just becomes who you are. And I've had such a beautiful career because of being a nurse. I mean, so many fabulous opportunities to do so many different things. And it's just been a wonderful path.
Yeah. I mean, tell me more about this mindset of a nurse. What is it how do nurses think? And I imagine you guys have to be really prepared, anticipate things. What else?
The big thing, I'll give you the perfect example. So Pat was sick and I was taking notes on, it just on my phone. I was just writing, on this day she was sick and this was the symptoms. And on this day she was sick and this was the symptoms. And we went to see her doctor, and the doctor said, well, how are you feeling? And she said, great. And I said, oh, no, that's not true. These are the issues. And she was very, very upset with me. And her friend, who is also a nurse, said to her, but that's how nurses think. They're always looking for trends. They're always analyzing the data. So they're going to take the symptoms to see what happens next. And so that's how nurses think. It's always about problem solving, right? It's like this symptom might mean this, but maybe it means this. So I have to gather more data to be able to do it. And so that's how I think.
Nurses think. Yeah.
That's
I
how
love
nurses think. Yeah.
Right. It's a secret weapon skill.
It is a secret weapon.
Yeah.
So just know that if you're walking down the street, you have a little limp, a nurse might see you and she's going to watch you walk to then identify, what's causing that limp? Is it her hip? Is it her knee? Is it her ankle? What's going on with that? So just know you're always being watched, Meg. The nurses are always watching you.
They're watching, eyes on you. That's great. I'm reassured by that, honestly.
Absolutely.
Before nursing, what is one of the hardest or weirdest jobs you've ever had that taught you something valuable?
Well, interestingly enough, I never had any other jobs. I was a nurse's assistant when I graduated from high school, and I went from that job into nursing school. So the only other, it wasn't a job, it was how I grew up. I grew up on a farm. So, we had cows and pigs and horses. And
that's great.
It was kind of idyllic. And so taking care of animals was part of my job. So, which could have absolutely led to, the caring component. Right. My niece is in vet school. Yeah. So, but definitely growing up on a farm gives you an appreciation for life itself. Right. You see, we saw puppies born and baby pigs and all of that kind of stuff. And just the beauty of watching corn grow and listening to the cornfields talk at night and all of those kinds of things. I think that's the piece of it that adds to why we do what we do.
I love that example or just where you come from. Where was this farm, by the way?
In Indiana. In Indiana.
The beauty of life, the miracle of life, our resilience, the human resilience, biology, the botany resilience.
Absolutely.
What is a risk that you have taken that maybe didn't work out, and what happened? What did you learn from that experience?
Well, obviously, when we first started, when I was working prior to purchasing Adobe, it was with another company, and we had a contract, and that contract went away. And when that contract went away, I had to lay off a bunch of people. And that was probably one of the most difficult times in what I've been doing. And what I learned from that was so much in relationship to, most importantly, being sure that we're utilizing the data that we have to tell a good story, right? To be sure that our worth is always acknowledged because we're telling the story, not just from hey, we did this wonderful thing for this patient, but also here's what the data is showing that we've done and the impact that we've made based on, our touch points and all of that. So that's what's made me even more in love with data is being able to take that experience and then change how we do what we do.
So would you say that is informing how you work today? It sounds
Absolutely. We have an awesome data analysis team, and we meet on a weekly basis. And so if you think about this, we've been gathering data in relationship to all the assessments that we do, in relationship to claims, in relationship to zip codes and gender. And so all of those things, millions of data points. So we're able to sit down and say, okay, what happens if we do this to this population? What does that outcome look like? And so we've just done a really deep dive into that whole readmission issue and what is the number one thing that stops that patient from being readmitted. And what we found after looking at all the data is that if someone is in that home within 7 days, If we're able to get in that home within 7 days, get them, make sure that their doctor's appointment, make sure that their medications, but most importantly, do they have enough food? Are their utilities paid for? Are they safe in their home? All of those things are looked at, and that reduces that readmission rate by 7%. It goes down to 7%. If we're in there within 14 days, it goes up to 14%. So it doubles. So that's just one example of the data that we look at.
Yeah. The experience you had where the contract went away, I'm sure that was just humbling and challenging as you described. How did you find the confidence to take on the challenge on your own and sort of build up this business on your own?
Because I always believed that it would work. I always believed in the theory of what we were doing, right? It was just give us this opportunity and start off with a small population, and we will show you what we can do. And that started out, our first contract was a very small contract. Our very first year, we had 12 employees, one small contract. We're now at over 160 employees, and, we have several contracts. And it was just, again, proving the theory, right?
Yeah.
This is what we say we can do. Let us prove it to you and continue on. And as we've grown, the number of programs that we've created and how we do things continues to shift. But that innovation and that drive on how we do it better just keeps happening. Right now, we've got 2 pilot programs going on to see how we can impact a diabetic population. And so it's just always using the technology, but also that human touch and the skills of our staff to see what other differences we can make.
Have you observed anything in terms of over the years, how clients, your customers, so the insurance companies, other people that you're doing business with, have you seen a change in how they think in terms of what they expect? And have you learned what to look for in a good customer?
Absolutely. One of the most interesting things that has happened is our largest insurance plan that we work with is, in the rural areas. And what they've done is, from a benefits standpoint, is that they now provide food.
Wow.
They now provide utility support. So they help pay for utilities. Their over-the-counter booklet now includes not just Band-Aids and aspirin, but other items that are essential. And so we've seen them understand and begin to understand and really embrace that these social determinants are crucial to being addressed in order to improve the outcomes. So that's been amazing. They're a fabulous partner. And whenever I meet with them, I always thank them for allowing us to, bless lives with their money.
Yeah.
So it's a win-win for both of us.
Yeah. Nicely put. How has your leadership style evolved over your career?
Pretty dramatically, I would say. I've always most often been in leadership roles. And when I got out of school and was called the little general, because I was very...
That speaks for itself.
Yeah, I was very, we're going to do this and that. And as one of my favorite quotes is Winston Churchill, who said, if you're not a rebel at 20, you have no heart. And if you're not a conservative at 40, you have no brain. So I've become far more conservative or not conservative, but really just engaging with others. And I think, too, the other piece of that is as you become older and you are in a leadership role, your role shifts to one of being a mentor and a guide, not so much as the person in charge, right?
Yeah.
So here's my idea. You guys figure out how to make it work. And obviously they do a better job, a vision that goes beyond mine. And so I think that's really the crucial piece is creating that trust in others and ensuring that they share your vision and growing with them. And that's the biggest piece. And it's great. It really is. It's an awesome way to live.
It sounds also too like the burden is not completely on your shoulders alone, that you share it with your team, and your team sounds like they readily take it and work with it and carry it forward.
Absolutely. Absolutely.
What advice might you like to give your younger self when you look back on the path you took? Might you have tried anything differently?
I have thought about that. And I think the biggest thing that I would want to tell myself is to always know that I was loved, because that makes risk-taking less frightening. And it also allows you to become who you really are. You know, if you can own that piece, to know that you were loved before you were born, then you are, you're just more willing to engage with the world as a whole and to walk through any door because you're not afraid, right? Whatever, somebody's got my back, and I'm gonna do this. And I think that is probably what I would want my younger self to embrace far more than I did in my youth. Yeah,
I can relate to that myself. Yeah. What do you do to recharge just for fun after you're running this business? What restores you?
We do a lot of things. I mean, we travel. Obviously, we're looking forward to being able to travel more now that COVID is, I don't know if it's going away, but it's doing whatever it's doing in this moment.
I know.
And travel, I read a lot. I go to the gym. What
are you reading? Are you reading anything spectacular? Or
I read a lot of history. And right now I'm reading a book called The Woman of No Importance, which is the story of an American woman who led the French resistance during World War II.
Oh, wow.
So it's a really interesting book. And we have 6 grandchildren. So that keeps us super busy, watching them grow and being engaged. The older ones are in a rock band, and the younger ones want to go to the zoo. So, it's, again, it's a lot of fun. We enjoy our family. And so,
is everyone kind of nearby? Is everyone in the area, or do you have to travel to see them?
No, all of our kids, all 4 of our children live in Arizona. So they're in and out of the house and at all holidays and all of that. So
that's awesome.
Great.
What innovation, accomplishment, or impact in healthcare are you most proud of?
Oh, absolutely. I would say this has been the pinnacle of my career. Just the ability to grow something from very small to substantial and to sustain it. That's the ongoing issue that we continue to focus on, is the sustainability, but also to take every day and create something new. And that's the beauty of it, is to say, okay, this is how I want to do it today, and see if this works. And because it's, mine, I can do that within reason, of course.
Right, but, exactly. Yeah. You're not a general anymore.
Right. There's not a ton of bureaucracy that's going to stop me from, or not me, but just anyone within the company from doing something, and having that openness to be able to do that. That's what keeps it all going, that creativity.
Can you talk a little bit more about the experience of bringing this idea to life, just from a market acceptance perspective?
Yeah, that's an ongoing struggle. It really is. It's an ongoing struggle. One of our biggest goals is to be in another state so that we can show that this just isn't an Arizona model, but that it's another model. So we've met with several states now, other plans in other states, and continue to talk with them. And it's just, this is what we can do. Give us the opportunity. And it's a very slow process, because you're shifting how healthcare is delivered. right? You're saying, look, this is really what needs to happen. And, well, we're used to just paying the doctors, and we're used to just paying skilled nursing facilities and hospitals. And that's what we're comfortable with. So it is that ongoing shift. And what we're really hoping is through the ongoing utilization of Maslow, we can gather even more data that substantiates, not just what's told by Census Bureau or nationally recognized that the seniors live in poverty. I mean, that's a proven data point, but that if we help them with their quality of life and help improve their quality of life, then those costs that you're paying to hospitals and skilled nursing facilities, those costs go down because they're living better lives.
Yep.
So that's really the push. That's the push of what we are focusing on. That's the innovation piece to create that revolution in healthcare. Come on, let's stop treating the disease and start caring for the people.
I was thinking we are paying 20% of our GDP is devoted to healthcare costs. And of course, some of that is the innovation costs. I mean, that's just the innovation happening in the space, but it's really the trend of rising costs of care. We have to change. Hopefully, this is the moment. And I think you're right. Now that we've got this data, the role of social determinants, where we live, our economic status, how much disposable income we have, all of those things impact our well-being. And so the idea that you are approaching it with a clear solution and resources to address it holds a lot of promise. It's very exciting. And do you think it is replicatable? Are there policies that are preventing wider adoption? Or are there other structural barriers that we should consider tearing down to make it easier for solutions like yours to be more readily used?
The main barriers are really a mindset. I think that's the biggest barrier. I think that, obviously the rural areas are those areas that are the greatest in need, because not only do you have, as you talked about, where you live, well, if you live in a rural area, there's not going to be a specialist closely available to you. There may not be those additional resources. So that's another huge barrier. You may not even have good internet, right? You don't have access to that. That's another barrier. And so the ability to create, as we've done, a solution that is specifically focusing on those rural communities. Is it replicable? Absolutely. Absolutely. It is. And the more that we innovate processes and the more that we're able to have data analyzed and all of those things that play into it, then creates that level of clear focus of what is exactly that we need to be targeting. Not that individuals are widgets, I'm not saying that, but that you have that clear ability to say, these are the things that we need to do, and these are the top problems that we need to address. And that's what we're going to continue to work on and focus on.
I think about people feel good helping others. We
Absolutely
get so much more out of giving to others than getting something new ourselves. More money for me makes me feel better, but actually me giving away that money is known to be more positively benefiting my mood, my feelings, my attitude, et cetera. So I would think that people being involved in this kind of organization, being able to participate and help their community, I would think that there is just a lot of high motivation to engage in that kind of work.
Absolutely. And once we get people hired, the difficulty right now is getting them hired. Once we get people hired, those that work with the patients, their longevity exists because they do have that whole feeling of, I did make a difference in this patient's life. Right? I did make a difference. And each one of our case management meetings starts out with, give us some positive stories, so that those are shared. And we talk about those in our all of our meetings. Is give me a story of what has happened and how you've felt that impact. One of the things that we say, well, if you leave, we know you're going to come back, and we've had people do that. So it's not just urban legend, and that it is a blessing. It absolutely is. That you're able to make that impact in someone's lives. And we talk about how, it's a ripple effect. You're this pebble that started this process. So you improve someone's lives, then they're able to look at their lives, and then they're able to look outside themselves. So then they're able to do something else. So it does create that cycle.
Yeah, it strengthens our whole social fabric. It strengthens our country.
Absolutely.
I think about this a lot, young people that are growing up in poverty, they don't have access to all kinds of things. And if they aren't taking care of themselves and physically well, it sounds so simplistic, but it just makes me angry to think about young people who don't have what they need to be strong and vibrant and engage in school. And it just plays out. And so to think of older people isolated at home, disconnected.
Oh, absolutely. Absolutely. And that's really, if you look at it, that's the premise of Maslow's hierarchy, which very simplistically says, well, if you're not safe, right, and you don't have food and all of that, then how do you have a sense of belonging? You can't get to that point. So that's the whole point of let's address those two barriers first. And then you increase that, and then they can feel a part of the community, and they can feel like they're worth something to their family. And all of those pieces all play into it. So if we are able to do that, even for a fraction of the population, it does create that shift.
Yeah. What gives you the most dread or hope? You can go either way as you think about the next 5 to 10 years in healthcare.
I try not to think about dread, right? I'm always looking at what are the possibilities. And I think that I truly believe that their healthcare is continuing to shift. One of the positives that has come out of COVID is all the innovation of how do we touch people that we were never able to touch. Right. So the increasing in telemedicine and the increasing in different types of reach out and all of those things that were happening, and how do we continue to do that? And I think that is happening. A perfect example is I met with a group of specialists, nephrology group, and I said, well, how often do you ask your patients if they have enough money for food? And they said, well, I never thought of it, but I should, right? So those kinds of things I see happening, and so I have a great deal of hope that how we deliver care is going to change dramatically. And the innovation and in technology and AI and all of those things are going to impact, how we do business, and in a very positive way. I feel very good about that. And the other piece of that too is, as I said, I work with a young crowd. I work with millennials, and their embracing of how it should be different, and their willingness to step up and create those innovations and to engage with that senior population is also awesome, because, somebody's got to take care of us, right? So we need to be sure that they're engaging and they want to do that. And so that's also, they have beautiful hearts. And so their willingness to do that is also a great hope as well.
I wanted to ask you just about healthcare data. How do you manage healthcare data? And what opportunities and or threats do you see as a result of the massive amounts of health data that continue to be generated every day?
That's probably the massive amounts. That really is the issue for us. I mean, big data is everywhere. And one of the struggles is, where do I start, right? Yeah. So what we have done is we've started very simplistically, and we've spent this whole quarter really just looking at retrospective readmission data. And then we're now what we will be doing next is starting to correlate that data, right? So correlate it with, as we talked about, level of depression, correlate it with lack of food, or all the different data points that we can pull out of our system to then identify what happens next.
Yeah.
The issue is we're a small company, so we can look at it from a very simplistic standpoint, but doing that deep dive for others is, I think, going to be very difficult because it's, again, where do you start with it?
Yeah.
The other issue is, and then that we deal with, is that we do get reports, from our contracted entities, and they're not always 100% accurate, right? Because we just had this conversation. So this person's pulling the report from this data point, and this person's pulling the report from that data point, and the two reports don't match. Yep. And so that's another issue. And then another issue is we're part of the Arizona HIE, so we get data from them. But then there's that variable of, but this hospital doesn't report it on a timely manner, or this hospital only reports this information and not that information. So again, you're not getting clean data. So we have a ways to go with how we manage data from a whole health system standpoint. And then, just from our point as well, is because clean data in means clean data out. But if you can't get the clean data in, then
it's useless.
It's useless. Exactly.
What do you believe are essential ingredients to innovation?
I think number one, you have to be willing to take risk. You have to also always be thinking outside of the box, or not believe that a box even exists. It's really taking that idea and doing that. What is the wildest thing that you would love to see happen? And then narrowing it down to a place where it's engageable, that someone could actually utilize it. If we could do what we would love to do, it would be so much more, but it would not be sustainable or cost effective, or all of those things that play into it. And never saying that's not going to work, or we tried that before. Oh my, those are the worst words in the human language when it comes to innovation, right? It's like, well, maybe we tried it before, but we didn't try it this way, or we should have tried it with this twist, or whatever. And so always being open to that, and acknowledging that creativity in places you wouldn't expect it to be. That's the other piece of it, is that anybody can produce that idea that's going to change things, even if they don't have this title or that degree or whatever. So,
wow, I feel like you should be a member of the team, because that's very, my career has been in innovation, and one of the very first things I was taught was everyone is creative. There are not creative people and non-creative people. It's like we all have the capacity for creativity and innovation as the first belief, first square one. And then the other thing that you mentioned, which we really believe in too, is that you really have to envision the wildest dream. Mm-hmm. So what is your wildest dream?
Well, my wildest dream would absolutely be that this model of care becomes the model of care for healthcare in the United States. That instead of getting a prescription for a medication that may or may not work, I get a prescription for free fruits and vegetables, that I get a prescription for a quality of life that allows me to live as healthy as possible. I mean, that's, to me, what we should be doing for everyone.
It's been really wonderful to talk with you, Jayme. Thank you for making the time.
Oh, absolutely. I appreciate the opportunity. It's been wonderful. Had a great time.
Thanks for joining us for the Game-Changing Women of Healthcare, a production of the Krinsky Company. Today's episode was produced by Calvin Marty, Chelsea Ho, Wendy Nielsen, and me, Meg Escobosa. This podcast is engineered, edited, mixed, and scored by Calvin Marty. If you enjoy the show, please consider leaving a rating and review wherever you get your podcasts. It really does make a difference. And share the show with your friends and colleagues. If you have any questions, comments, or guest suggestions, please email me at meg@thekrinskyco.com. And you can visit us on the web at thekrinskyco.com.